I'm Thomas Baldrick at ASH 2014. Happy to have with us Dr. Shyamala Navada from Mount Sinai Hospital in New York. Thanks for coming by.
Thank you for having me.
Let's take a look at this phase 1, phase 2 study for MDS and AML patients. Can you give us an overview first?
Sure. So this study combines standard dose azacitidine, which is first-line therapy for patients with higher risk MDS, with a more novel agent called Rigosertib in its oral form. So the goal of the study was essentially to assess the safety and toxicity of the combination, since it's a phase 1 study, but also to assess for response for the combination of drugs in patients with both MDS and acute myeloid leukemia. In the laboratory, we found that the two drugs were synergistic in human leukemia cell lines, and the synergism was sequence dependent, with the Rigosertib preceding the azacitidine. So we used that study design in order to test the combination in patients with these diseases.
What was the methodology used?
So we administered oral Rigosertib for 21 days out of a 28-day cycle. So patients were given the supplies to take home. And then the azacitidine, given that synergy was sequence dependent in the lab, the azacitidine was administered starting in the second week for 7 days at the standard dose of 75 milligrams per meter squared, either subcutaneously or intravenously. Since this was a phase 1 study, everyone got standard dose azacitidine, but the Rigosertib was given in cohorts, starting at a low dose of 140 milligrams twice a day and then escalating to 280 milligrams twice a day in cohort 2, and then 560 milligrams in the morning and 280 in the afternoon in cohort 3, which was the dose that we were using in other oral Rigosertib studies where the drug was being used alone. And so we enrolled anywhere between 3 to 6 patients in each cohort, and assessed for safety and toxicity before moving on to the next cohort. And 18 patients were enrolled in the phase 1 study. We found that the cohort 3 was actually safe and well tolerated, in addition to the other cohorts. So we moved with that dose to the phase 2 arm of the study.
So what do you see as the key findings so far?
So far, we found that the combination appears safe and well tolerated. The adverse event profile is not much different from azacitidine alone. In cohort 1, we had to expand the cohort because we had elevation in creatinine in one patient, which we thought was probably related to disease because this patient had AML, but in order to be safe, we expanded the cohort. Otherwise, the most common toxicities are things like fatigue, nausea, GI toxicity, but generally mild. And the toxicities do not differ that much between among the 3 cohorts. We also, in terms of assessing for response, we actually did see that we had about 11 out of the 18 patients so far that we've assessed had some type of response. So there were 5 that had marrow complete remissions. There were 4 that had complete remissions with incomplete hematologic recovery, and 2 with stable disease. And one of the compelling things for us was that there were 2 patients who had previously failed or relapsed on a hypomethylating agent that then responded to the combination. And that's a patient population that we don't have any standard therapies for at this time, so that was quite interesting to us.
That's encouraging. So what kind of future do you see for this combination?
So at this point, given that it's safe, well tolerated, and appears to have some responses both in de novo MDS patients and AML patients, in addition to hypomethylating failures, I think that moving forward, we are now in the phase 2 component. I think that our initial results are promising, but we do need more patients to really assess the true response rate of the combination. And I think that we have potential to continue to move this forward, since it's a patient population that doesn't have a lot of treatment options.
Good luck in helping these patients. Thanks for stopping by.
Thank you.